also want to remind everyone that the Scleroderma Foundation does not endorse any specific treatments, drugs, or research trials. And because scleroderma affects all patients differently, treatment approaches that may be appropriate for some patients may be less suitable for others. Any treatment decision should be based on knowledgeable discussions between patients and their clinicians. And I would like to introduce our guest speaker, Dr. Susan Nyanzi. Susan is a graduate from Loma Linda University School of Public Health with a doctorate in public health with a subspecialty in chronic disease management. As a public health professional, she specializes in integrated lifestyle counseling for the prevention and management, of chronic degenerative disorders such as scleroderma, rheumatoid arthritis, diabetes, and heart disease. As a patient, Dr. Susan advocates for policies that affect those with chronic conditions, presents at local and national conferences, and writes on prevention and public health in local national magazines. As a public health professor, Dr. Susan teaches adult learners public health policy and management, public health leadership and systems, design and analysis of community trials at the doctoral level. She is a master certified health education specialist, a certified gluten-free educator, a member of the American College of Sports Medicine and Royal Society of Public Health. Susan single-handedly executed a patient-to-patient experience symposium in 2016 held at Terranea Resort in Palos Verdes, where she put together a retreat for patients by patients where they can connect, learn from each other, and in the process improve on their quality of life. She accomplished this by empowering and educating those living with chronic condition to better manage their health and well-being by giving them evidence-based integrative approaches. Susan has been kind enough to speak at support group meetings as well as participate in patient panels, sharing her journey living with scleroderma, and also recently joined the board of directors with the Scleroderma Foundation. Susan has also had her share of ups and downs with her health, but always fights to get back on top and sets a wonderful example of optimism and perseverance. And we couldn't be proud of this extraordinary warrior. So without further ado, we would like to welcome Dr. Susan Nyanzi, who will be talking with us today about nutritional tips, strategies to help bypass scleroderma problems. Thank you. Take it away, Susan.
Thank you very much. A great introduction. So Emmanuel, if we could put the presentations up, please. Thank you. Thank you. So what I'll do is actually, let's go back to the first page. Well, actually, Tina introduced all of that. Okay, we'll go into the next slide. We'll just go straight into the presentation. Okay, so the ultimate goal of scleroderma treatment is really improve on quality of life, reduce pain and suffering, and reduce further organ damage. So how is it currently done? Ideally, you should have a team of doctors that take care of everything. They monitor medications, their side effects, they monitor the interactions, the foods, what foods you should be eating. And really, you should have a team that includes your rheumatologist, of course. And if you notice, I've put neurogastroenterologist, because a general gastroenterologist is not going to understand the motility issues that we're going to have because of scleroderma. The neurogastroenterologist understands the motility issues. And so you really want to have a neurogastroenterologist as part of your team. So at UCLA, they do have one, and that's Dr. Terry Getzerg. So anyway, on top of that, you also want to have a physical therapist, a nutritionist, and a psychologist. So that would be the ideal situation, but that's not always what we have. Next slide, please. Next slide.
I'm trying to get it. There it is.
Okay. Now the next one. Can it move?
You're not seeing it move?
No, it's still the first one.
Oh, okay. Hold on. Let me fix it here. Sorry. I'll fix it. Stand by.
So in real life, you usually have your rheumatologist or an internist. Some people even have general rheumatologists when you really need to have a rheumatologist that specializes in scleroderma, or you'll have internist who has a little knowledge or experience about scleroderma, but they don't fully understand how it works. So you're pretty much left to your own devices to figure out what to do and how you should manage even your nutritional needs. And usually there isn't anyone to talk about what you should eat, you know, why you feel the blues, and really figure out what's going on. So all of those bullet points are kind of related to what to eat and what you're not eating. Next slide, please. So why is nutrition important in scleroderma? So what it does, it helps. So balanced meals are going to replace vitamins and minerals you may be deficient in. And so this could be related to the scleroderma itself or the medications you're on. So it's always a good idea to build up on your natural resources. And you want to prevent the side effect of nutrition deficiencies. So if you're low in some of the minerals and also some of the vitamins, those also do have side effects. And so the idea is to clean up the messes scleroderma has left behind. So the omega-3 fatty acids, vitamin E, flavonoids, all help with inflammation and softening the skin. Vitamin B3, also called niacin, vitamin E, and magnesium help with Raynaud's. So all of those vitamins I just mentioned have been known to dilate blood vessels and minimize the effects of Raynaud's. The other reason for proper nutrition is to maintain strength and energy. So balanced meals are high in energy. And so these are your carbohydrates, your proteins, fat, and fiber, and of course the vitamins and minerals. And to improve of quality of life and enjoyment, we want a proper balanced diet so we can feel the best we can be most of the time. So I have a question for everybody. Would you consider fast food being as good as fresh food? Okay, so we'll go into the next slide. So we've got we've got some links that we're going to go through, but we'll just scroll down so we have an idea of what it's saying. So the difference between fresh food and fast food. So a lot of the advertisements now, they're trying to show that fast food is healthier, when in reality, it's really not. So most people should know the question, which is better and why? Okay, so Emmanuel, can you click on the link? The first one, yeah. I hope it's gonna go. Did it go? Okay, and then we can just slowly scroll down as I talk through it. So, you know, the hot dog seems innocent, but it has all of these components in it. Palm oil, really not healthy. It has all these other things in it. The shortening that is used also has all these negative things to it. And they're using white flour when really whole grain is a better option for us. High fructose corn syrup, that is our enemy. We should not be eating or drinking or having anything with high fructose corn syrup. And of course, the artificial sweeteners, and then the sodium benzoate and potassium benzoate. So those are known. They're added preservatives, but they're known to change the DNA, and that will be the same with the next one, BHA. So all of the fast food pretty much has all of these ingredients in it, and those are not good for anybody, especially someone with the chronic condition. It can just make things worse. Okay, if we can get out of this slide, and then we can go back to the presentation. Thank you, Emmanuel. And so the next point, so we've got a quiz, fast foods. So of course they have, they're very overly processed, and they also have additives in them. If we can get to that link as well. And so these links are from reputable sources. And let's see what this one is from. Yeah, so this is from the Center of Science in Public Health Interest. So again, if we can just scroll down slowly. So it's telling you the calories and all the empty elements in the food. I guess some of these are from the West Coast, because I've never heard of Five Fleshy Guys. But again, it's comparing it to McDonald's Big Mac, and you look at the calories in all of that. Campbell's noodle chicken soup. Who knew it had so much sodium in it? And then also this is Chipotle. You know, I thought Chipotle was really healthy, but look how many calories are in there, and the saturated fat that is in there. So all of those things are not going to go well with someone with the chronic condition. So we've got empty calories, and then we've got high saturated fat. All of these actually can trigger more pain. Even though it feels good when you're eating it, but within hours, you're going to have pain, or because it increases inflammation throughout the whole body. Yeah, so we can go back. Yeah, let's go down a bit more. And again, this looks very innocent, but look at the calories, how much saturated fat is in there. And then also Starbucks. They have nice drinks, but look at the calories and everything added on there as well. Okay, we can go on to the next slide. Oh yeah, back on our side. Okay, so now we've seen fast food is really not as good as it's being advertised. So we want to stick to our healthy foods. Okay, so we know our healthy foods are our fruits and vegetables and grains. So now what would be the best place to get these kind of foods? Supermarkets are known for their fruits and vegetables, for picking them early so they're not as ripe. And then what they do, they spray them to make them look ripe. And it's not the natural process that is taking place. The natural process of ripening also adds taste to the fruit and vegetables. So the supermarket ones, they may look ripe, but then when you bite into it, it's not going to be, it won't have much of a taste. It's going to be more tasteless. So you want to go for organic fruits. And now, because of the pandemic, there are so many delivery services out there where you can get fresh fruit and vegetables, which are organic, and you're going to get seasonal fruits and vegetables. So you're going to increase on your variety of fruits and vegetables. So my option would be to get the delivery services. I don't think they do food markets anymore. That's not the right word, but I hope you understand what I'm trying to say. So it's trying to get away from the supermarket foods, because those are not going to be as beneficial for our health. And then we have the deli meats. Of course, those are processed and high in additives. For those who attend the cooking class that I host at City of Hope, I go in more detail about the deli meats. They're usually high in, because of the, to make them, I guess, taste better, there's so many additives added in there. And a lot of these additives have been shown to be detrimental to us. So for us with autoimmune conditions, again, these additives they're adding in here can trigger inflammation, which means we're going to be in more pain. That will be the same with pre-cooked supermarket foods. If it has a big fat list of ingredients, that's not going to be good for us. Okay, so now to know whether you've eaten enough healthier options, it's good to track down what you eat. And so you can also create it or even find it online where they have meal plans or meal plans you can have for the whole week. So you just get an empty one, write down what you've eaten for the next couple of days and see where you're eating mostly the good foods and where you're eating mostly the bad foods, and hopefully increase the amount of the good foods that you're eating. Okay, next slide. Okay, so this slide, I call it foods and relief. And so with scleroderma symptoms, we have a lot of inflammatory pain. So what are some of the things we can eat that can help reduce that? And so freshwater fish is really good. And SMASH is the acronym of the types of fish you should be eating. So S stands for salmon, M mackerel, A anchovies, S sardines, H halibut. So these fish have the highest amounts of omega-3 fatty acids. Omega-3 fatty acids are our friends because they block the pain pathway. So if we're having a lot of inflammatory pain, these types of fish are going to help us with reduced pain. Other types of foods are those that are high in flavonoids. And again, these are chemicals that reduce the initiation of inflammation. So these are going to be your fruits, any fruits that you like, your vegetables, any vegetables that you like, and then nuts and beans. Other foods that are also beneficial are your vitamin E foods. So we want to eat foods that are high in vitamin E because they have antioxidants. Antioxidants are beneficial for our system too. They're going to help with inflammatory responses. They're going to help soothe things that are happening in the body. So antioxidants are good if the body's going through stress. It's going to help reduce those. And so foods that are going to be high in this are seed oils, like your sunflower oil, what's the other one? Olive oil. These are all good. And then nuts and seeds. So almonds, sunflower, cashew nuts. So all of these have high levels of vitamin E. And again, vitamin E is a high antioxidant vitamin. And we want that because it's going to kind of soothe what's happening in our body with inflammation and also with stress. The other foods that we also want are, yes, just saw that. Walnuts are also good. Yeah, so a good variety of nuts would be great. So other foods we want are foods that are high in, it's a compound called GLA, and I can't remember the name of that, but it also reduces inflammation. And so this would be good. Where we can find this would be like vegetable oils. Now they mentioned primrose as a good oil, that would help. Okay. I know what GLA is. It's gamma linolenic acid. So that is very good for the body, and we want that. And that's also found in seed oils. And actually, it's also found in some meats. So we can look that up. I think I talk about that later on in this slide. Okay, let's go on the next slide. I know today is just not our day with technology, but anyway, we'll keep going. Okay, so now we're gonna look at Raynaud's. Are there some foods we can eat that are gonna help us with Raynaud's? Yes, there is. So we know Raynaud's is about narrowing up the blood vessels when temperature changes. And actually, even though yesterday was a great day here in Southern California, I went into a room which was a lot cooler and my Raynaud's just came on, even though outside the temperature was pretty good. So it's really changes in temperatures. So holding a cold glass can set it off. And of course, air-conditioned rooms can set it off. So we want foods that are going to dilate the blood vessels. And some minerals that are going to help with that are foods that are high in magnesium. So the green leafy vegetables, spinach, that's going to be a good one. The foods that are high in omega-3 fatty acids. Remember, this was in smashed fish. And then also nuts and beans. These are also high in magnesium, which is going to help dilate our blood vessels. And again, foods that are high in vitamin E. Vitamin E is our friend, and that's an antioxidant. It's going to help soothe the stresses that are going on within the body. So we want to keep those. And so that's found in your seed oils, your sunflower oil, your olive oil, those kind of options. And then also it's in nuts and seeds. So your almonds, your sunflower, and your, so nuts and seeds. And then also it's found in your vegetables. So here I've put red, orange, green vegetables and fruits. So mangoes, tomatoes. And if you notice, I'm emphasizing a range of colors. So we want a range of colors of fruits and vegetables that we're taking in on a daily basis and also throughout the week. Then we also want to have foods that are high in vitamin B3. So vitamin B3 is niacin. That's also been shown to dilate blood vessels. And so that one we're going to find in tuna, in eggs, and in green leafy vegetables. Okay. Okay, and then the next slide. So many of us with scleroderma, we may end up with the blues. So those blues can be related to scleroderma itself, could be related to something we shouldn't be eating, could be related to the side effects of some of the foods we get. So it's not, let me phrase that again. It's common for anyone with a autoimmune chronic condition to get the blues. And so we've got to differentiate between the blues and the deep depression. The deep depression, you're going to need to see a provider for that. And you can add in or change the way you're eating as well. For the regular blues, we can just change the foods that we're eating, and hopefully that's going to help as well. So we're going to want foods that are high in serotonin. Serotonin, it's a neurotransmitter in the brain. It's the happy feel-good neurotransmitter. And that one has been shown to reduce depression and the blues. So the idea is to manage the blues and have a good balance of serotonin and dopamine. So, and again, these are both neurotransmitters in the brain. So diets that are rich in omega-3 fatty acids, again, remember the fish that we can eat that is high in omega-3 fatty acids, that is the smash, they increase the serotonin levels. If we have good serotonin levels, the feelings of depression go down. There are other foods we can eat that can help increase the serotonin. So with salmon, that's part of the SMASH group. Then we have turkey. Turkey has the precursor for serotonin, and we can change that in our bodies. Eggs, nuts, and seeds are also good. They will have the precursors for serotonin, which we would like to have on a regular basis because it's the happy feel-good hormone. So poor eating habits, like eating junk foods and fat, that's going to reduce the serotonin levels. So be mindful, you know, if an In-N-Out hamburger looks appetizing, you used to love them, but that's going to decrease your serotonin levels, and the blues are more likely to come on. Fruits are also good. So fruits like a banana, if you can take bananas, 2 a day are good. And of course, chocolate in moderation is also good. Those are good at increasing the serotonin levels. Yes, dark chocolate is better than milk chocolate because a lot of us who have GI problems are gonna have intolerances or allergies to dairy. Okay, next slide, please. Okay, so let's look at some of the deficiencies. So a lot of the scleroderma patients were low in vitamin D. And actually the general population as well, they're also low in vitamin D. Low levels of vitamin D have been shown at increasing pro-inflammatory molecules, such as cytokines. So cytokines, interleukin-6 is a very high pro-inflammatory molecule. So we really don't want that. And we have a lot of that because we have an autoimmune condition. So a great way of reducing that is making sure your vitamin D levels are at the right amount. So naturally, we can get the vitamin D by being in sunshine. So some articles that I went through, they were saying 13 to 15 minutes. I will go 30 minutes if you can. And so sunshine on your arms and legs, that will help form the vitamin D that we need. So those reactions take place in our body systems. So adequate vitamins, vitamin D is going to decrease the cytokine interleukin-6. So we don't want any more inflammation. We want to reduce that inflammation as much as we can. So if that means we need to get, you know, some tablets and get it from our diet, we need that vitamin D to be at the adequate level. So with some people, especially in scleroderma patients, our numbers are going to be so low that diet alone is not going to bring it up. You will have to take some vitamin D supplementation to get it up at the high level, and you want to keep it at that level. so you can do the natural sources as well. So we talked about being in the sun, and from the literature I've been looking through, they're saying the sun at around noon. So if you can be in there for about 20 minutes or so, make sure the arms and legs are exposed, then the conversion of the vitamin D we need can take place in our bodies. Other sources of vitamin D is, again, the freshwater fish, the smash. Other good food sources, egg yolks, fortified cereals, and soy milk. Okay, next slide, please. Okay, so recommended doses of vitamins, minerals, and flavonoids, these are all our friends, from balanced meals and supplements. They're going to add additional benefits to your treatment plan. They're going to improve on your quality of life, and you want to make sure your meals are balanced. How can you tell that your meals are balanced? And with this, we can follow public health guidelines. Most scleroderma patients usually avoid foods that are high in nutrients because of mechanical problems. So that could be the chewing part of it, that could be the swallowing part of it, that could be because of scleroderma, you're not absorbing enough. Oh, and again, it could be because of scleroderma, we get constipation, or because of scleroderma, we get diarrhea, or again, because of scleroderma, we have no appetite. But we do need to get those nutrients in. And so how can we bypass the mechanical issues and get the nutrients that we need? Okay, next slide, please. So here are some public health guidelines that we can follow and try and get to them as close as we can. So for the general public, they're told to drink 8 to 12 glasses of fluid, preferably water. So this will be in an 8-ounce glass or larger. So if you can drink as much as you can, and again, I'm just saying for scleroderma patients, if we can go up as close as we can to that number, that's going to help a lot. If you can get to 8 glasses, great. If you can get to 7 glasses, great. But remember, it has to be an 8-ounce glass, and preferably water will be the best. So this is going to help fight constipation. It's going to help fight lumps. You know, if the esophagus is not working the way it should be, that's going to help move that along. It's also going to hydrate dry skin and keep the kidneys working well. So if we don't drink enough, our kidneys don't work as efficiently. The best way to keep the kidneys working the best way they can is flushing them with fluids throughout the day. So another one. So another guideline is how much fruits and vegetables should I be eating? For the general population, the Surgeon General recommends 1.5 to 2 cups of fruits and 2 to 3 cups of vegetables. Okay, those are the guidelines. If we can just get close to those guidelines, that will help us. We have GI issues, so we might not get to the recommended amounts, but if we can get close to them, that's better than nothing. I'll give myself as an example. I can't take too many fruits and vegetables. So what I did is I slowly went up to see how much I could eat without getting gas or bloated stomach, but just enough that I could get a bowel movement. So now I know how much fruit and vegetables per day I can eat that will help with bowel movement, that won't give me issues. I won't get too much gas, or I won't get any gas, and the stomach won't be bloated. So why we want the fruits and vegetables? Because they're going to replace the vitamins and minerals that we lost because of scleroderma or because of our medications, and it's going to help with healing as well. So as I said, most of us are going to have motility issues. And so if we eat too much fiber, which is in the fruits and vegetables, this is going to, oh no, I'm sorry. This is what I said earlier on. If you have motility issues, slowly increase the amount of your fruits and vegetables, depending on how much your GI can handle. And you also want to spread it throughout the day. So don't eat all your fruit in the morning and then think, oh, that will be fine. No, you're going to regret that. So we want to space it out throughout the day. So other ways of getting the fruit in, you can make smoothies, you can do sauces or purees like applesauce or apple puree, or even baby food. And I'll give you an example for that. In grad school, for some reason, they think they can give you classes that are 4 hours long. So we used to bring snacks throughout the day. And one of our classmates, even though we were laughing at her, but she would come in with baby food. And those were her snacks. And she was able to get her fruits and vegetables in that way. Okay, next slide. Okay, so carrying on with the public health guidelines, we also need to intake grains. So how many grains should we be taking? For women, the Surgeon General recommends 5 to 6 ounces for women, 6 to 8 ounces for men. And again, this could act as a plug for us scleroderma people. So let's try to get to close to that number as possible, and making sure it's not causing distress, making sure it's not bloating up the stomach, making sure we're not, again, in distress, but we can handle enough that our body can handle. So this is going to help fight with constipation. It also reduces our risk for cancer, such as colon and breast cancer. So again, here with motility issues, slowly increase to the amount your GI can handle. And again, we want to spread that throughout the day. Now, this one is I had to put this in here because it also applies to me. And so when I went gluten-free, my body totally changed. The gluten was not good for me. And so for many of the scleroderma patients, that might be the issue as well. Gluten could be an issue. So they're gluten-free options. You can put in rice, brown rice would be good, buckwheat. You can even have buckwheat as a porridge. That comes out really good. Millet, that also comes out really good as a porridge. And of course, quinoa. And then how would you know what you have is celiac, which is the allergy to gluten, or you have gluten sensitivity? So there are 2 ways of finding out. There's the poor man's test, which is eat as much foods with gluten in it, pasta, beer, everything with gluten in it, and then see how you feel the following day. If you're in pain, agony, the whole body's in pain, GI issues, then maybe you have celiac, or maybe you have the gluten intolerance. the best way to find out is to do a blood test. And I'll give you an example also with me. Sometimes with gluten intolerances, it will show up with really severe anemia. So I kept having really severe anemia down to 7 and 5. That's really low. And so my doctors kept saying, okay, we'll give her the iron tablets, or we'll give her the iron infusion, and that should bring it up. And I'm going, no, something is not right. So I looked it up myself, and I found that in the gluten celiac community, they were talking about scleroderma. And so I thought, okay. And they used to have a gluten-free conference in Pasadena here in Southern California. And I would go and they would have the top gurus in celiac there. So I would ask them, you know, is celiac or gluten intolerance common in scleroderma? And to them, it was, you know, a no-brainer. Yes, of course, you have it. And so looked it up in the literature, and yes, that was true. And so I asked my primary provider to test me for it. And I remember him telling me, no, you're not gonna have it. You're an African lady. It's not common in African ladies. It's in Caucasian women of Norwegian descent, Scandinavian descent, who are gonna have it. I'm like, no, I'm not gonna leave until you test me. You know, rolls his eyes and okay, I'll test you. Well, the following morning, 8 o'clock in the morning, he calls me, well, your lab results came back. The normal range was 0 to 11, but yours was 398. So I'm going to set up an appointment so you can see a GI doc. And I'm like, no, that's okay. I'm just going to go gluten-free. And that was the best thing I ever did. My energy came back, and I'm doing perfectly well now. So now the other thing we're going to do is, the other part we're going to talk about is reducing saturated fat. So saturated fat is bad, and we also want to reduce refined sugars. Once we reduce both of that, that's going to help reduce our inflammation. Now, if we have absorption problems and weight gain problems, then there are other options that we can take that can help. But definitely reducing the saturated fats and the refined sugars, that's going to help reduce inflammation. Saturated fat and refined sugars open the pathway for inflammation. And so you'll be in pain again because of the inflammation. So we want to stop that. Okay, the next slide. Okay, so here I've just put some pictures in here so we can have an idea of how things look like. And so we're going to start with the esophagus. So I'm going to talk about the different parts of the GI and what issues are most common, and then what would be a plausible nutritional diet that we can follow that can help that. So usually with the esophagus, we have the main issue of the lump. Foods get stuck in the throat. And usually that's because the peristalsis is not moving the way it should be moving. It should be moving in a sequence. But with scleroderma, that sequence goes away and the esophagus just moves randomly. It doesn't go in sequence. So the food is going to sit there, it's going to burn. Pardon me. It's going to burn the tissue. And you can get heartburn or GERD. And so you're going to need some medications to help with that. Now, the solution part and kind of what the literature is saying, you want to switch to soft foods so that it doesn't have an opportunity to get stuck in the throat. A liquid diet would be also good. Other natural things you can do is to let gravity help. So you want to sit up when you're eating, sit up for 3 hours after you eat, and also keep moving, like walking. You'll be in the upright position, but also walking helps activate some of the GI muscles to work. So you want to keep walking as well after eating. And then keep drinking on fluids, especially water. Juices are going to irritate if you have strictures or some ulcers in there. Juices are going to irritate that, so you want to keep away from that. And then also you want to stay relaxed. When we stay relaxed, the muscles stay relaxed. And if we have a little movement, that will help. If we're anxious because we've got this food stuck in the throat, or we're thinking something is going to get stuck, that's going to trigger your cortisol hormone, which is not going to help. If we have lumps and things are not moving the way they should be moving, let's just relax and get over that hump. Okay, the next slide. I think there's one slide we left behind. No? Okay. So this is an example of a menu if we have esophageal problems. So we can have, if you've noticed, I've put cream of rice instead of cream of wheat. And you can make that with fortified soy milk or fortified nut milk, any nut milk you like. And then you can follow that with the fruit soup, with a fruit smoothie, and then some tea and juice or water, whichever is best. So that will be for breakfast. And then you can have a morning snack. I've put here 8-ounce container of applesauce. And again, you're not taking it down all at once. Take your time eating that, or even a banana if you can manage a banana. And now for lunch, I've put shepherd's pie. So for those who want to know what shepherd's pie is, it's mashed potatoes with ground meat and peas and carrots. You can get those really cooked so that they're soft and they're easy to eat. And then for dessert, you can have grapes or sliced mangoes or papaya. In the afternoon as a snack, you can have some strawberries and blueberries. Again, both of them are high in antioxidants. Antioxidants are our friends, so we want antioxidants. And then for dinner, you can have grilled salmon, a small piece, and you don't want to overcook it because then it gets hard. So you can look it up on the internet, how many minutes you can cook a small piece of salmon. And it comes out really flaky and it's fine to eat. For me, it's doable. And then with rice and spinach. So this will be an example of a menu or a meal plan if we have the GI issues. Okay, the next slide. Okay, now we're going to talk about the stomach. So the stomach has 3 main functions. Temporarily store the food, mixing and breaking up the food by contracting and relaxing the stomach muscles, then pushing it into the small intestines to continue with digestion. Well, sometimes in scleroderma patients, those stomach muscles are not working the way they should be. So they might become fibrotic, meaning that the muscles won't be able to contract and move. And then the nerve muscles that integrate won't be as effective. So they're going to be dulled. So the peristalsis that happens in the stomach is not going to be as effective. And so it's not going to be able to empty the stomach as much as it can. And so that is called gastroparesis. And again, when I was looking through the literature, the solutions that we're saying for gastroparesis is you want to eat small meals. So 5 to 6 or more meals per day. Now, this is different from grazing. Grazing means you're going to be eating throughout the day. This one, no. We want to eat small meals and then have a rest, small meals and then have a rest. The reason for that is kind of giving the gut some time to rest. And maybe if our peristalsis is not that good and we still have a little bit, it will allow that little bit to do some pushing as well. And then you want to drink your fluids so you don't get dehydrated. So 6 to 10 glasses, preferably water per day, that will be good. And we want to reduce the fat and the fiber in the stomach, pardon me. Pardon me. So we want to reduce the fat and the fiber because they both slow down stomach emptying. And the idea is to increase the stomach emptying so things can move out quickly. And then after eating, take a walk. Again, gravity is going to be acting. And then when we're walking, it engages some of those stomach muscles to move. So that's going to help. And also you want to sit up while eating. And after eating, you want to be in the upright position for about 3 hours, again, to help things moving. So I have a diagram here showing what a healthy stomach and small intestine looks like, and then one with gastroparesis. And then let's click on the link. That is another example of a gastroparesis diet that we can follow. Okay. Yeah, and actually before we move down, can we go back up a bit? I would like everybody to know about this website. It's the International Foundation for Gastrointestinal Disorders. And they talk about scleroderma, all the different parts of issues we may have with scleroderma. So please make sure to check out this website. You can learn a lot. You can share it with family and members so they know what's going on. Okay, now let's go down. Okay, that's good, that's good. So now this is showing a sample of what you could eat with gastroparesis for a day. They've got cream of wheat, but we've got cream of rice for those who have gluten intolerance, or they have celiac. And most of us are going to have dairy issues. So I recommend a nut milk, and it's going to be healthier. And then you can have a juice, and again, I recommend water. You can have a snack, and then it talks about what lunch you can have. And please notice it talks about half a turkey sandwich, not a full turkey sandwich. And then also for dinner, it's talking about small ounces of chicken or fish. So let's keep that into mind. And then it's also talking about a small portion of mashed potatoes. So portion size is also going to be important here. Okay, we can go on to the next slide. Yeah, okay, then, yeah. Oh yeah, this one, okay. So now we're going to talk about the small intestine. its function, and if we have issues here, what can we eat? Or yeah, what can we eat? So for the small intestine, its function is to absorb nutrients. So vitamin, minerals, all the nutrients from the food we eat, and it goes through the bloodstream and it goes to all different parts of the body which need it. The waste is pushed into the colon, and the colon, draws water out of that and excretes it. Now I've got a picture here, again, for us to have an idea how things are set up in the stomach and how things are connected. Okay, let's go on to the next slide. Okay, so in scleroderma, muscle and nerve endings that propel the food, and remember we called that peristalsis, gets dulled. And so the peristalsis is not as effective as it is for moving the food along. So things get sluggish, and the food in the small intestines stagnates, just sits there. Well, in the small intestine, we have a small portion of bacteria, helpful bacteria that help. However, when the food is just sitting there, the bacteria feeds off the food. They grow out of proportion. And so this is where the bloated stomach comes in. And this is where we get the gas. So the bacteria, they get fat because they're eating all the food that we ate. And since they're competing with us to get the food, they get to the food before we do. So we get malnourished, we lose weight, we develop vitamin deficiencies, we're not able to gain weight. Now, this is called small intestinal bacterial overgrowth, SIBO. If the SIBO is not picked up right away and it goes untreated for a while, this can result in food sensitivities as well. And then the immune reactions are not immediate. They're usually delayed. So we can go up to 72 hours before they come on. And most of the sensitivities are going to be sensitivities to dairy, to eggs, to wheat, gluten, corn, and soy. And so I was reading through one of the papers that was looking at this, and I think it came out a year ago, 2 years ago. It said that 43 to 56% of scleroderma patients have SIBO. Okay, next slide, please. And so the solution to help with SIBO is the Fodmap diet. And so this is fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. That means the small intestine has a hard time breaking down these foods and absorbing them. So the whole idea of the Fodmap diet is to stop eating foods that are high in these chemicals. Well, actually, it's not chemicals. They're long-chained, medium-chained fatty acids. So foods that are high in it, the idea is to stop those and then slowly reintroduce them one by one into your diet. And then those that are really troublesome, you want to avoid them or limit them. So for SIBO, the treatment for SIBO is your scleroderma team, your rheumatologist, and your GI doc. They're going to prescribe antibiotics you can take that are going to get those bacteria down to their normal levels. And so they're going to give you maybe 2 antibiotics that you're going to rotate through every 2 weeks. Then they're going to add on the Fodmap diet to help reduce the symptoms or the effects of SIBO. Now, we've got to understand the Fodmap diet is not going to treat the underlying cause of the SIBO. It's just going to decrease the symptoms of the SIBO. Your scleroderma team, your rheumatologist, and your neurogastroenterologist are the ones who are going to identify what is the underlying cause of your SIBO. Okay, the next slide. Okay, another issue that happens within the small intestines with scleroderma patients is pseudo obstruction. So again, the small intestine, we have the SIBO going on. We don't have very much peristalsis going on. And so the bowel, it feels as though the bowel is physically blocked, but it's really not blocked. It's just the peristalsis is very little, ineffective, or it's not there. So the small intestine has just had enough and it's not working efficiently anymore. And usually it's the neurogastroenterologist who is going to pick up that you also have infection. The general GI might not pick it up in scleroderma patients. So anyway, the solution for that also is to eat small meals throughout the day. Again, not grazing, but small meals, 5 to 6 meals throughout the day. So there's a time when you're eating, then there's a time when you're not eating, there's a time when you're eating, and there's a time when you're not eating. And again, with this one, you want low fat and low fiber because both of them are going to delay stomach emptying, or they're going to delay movement in the small intestine. We don't want that. We want things to move. So we want things that are going to increase movement. If it's going to slow down the movement, that means you're going to be in more discomfort. You're going to have gas, distended stomach, not hungry, you might get nausea, and all of that. So that's why it's important to take that into account. Now, when you have pseudo obstruction, you're not getting the nutrients you need. And it also means you're not absorbing nutrients from the small intestines. And so you don't have enough calories to have all of the systems in your body working. So you're deficient in calories. And this is where they need to add on extra calories. So the first step they do, well, this one, enteral feeding means you can still absorb, but maybe you have issues up in the esophagus or in the stomach where it's not working too well, but you can still absorb. So they do enteral feeding. And so that's tube feeding. And there's several ways they can get this done. Now, if you can't absorb, then they bypass the gut altogether and do a feeding in your vein. Okay, let's go on to the next slide. So enteral feeding or tube feeding, a person cannot eat enough, this is what we were talking about, cannot eat enough nutrients to support the body. So extra calories are calculated for that individual. Now, a good team, which is going to be your rheumatologist, your GI doc, that will include you in determining how much fat carbohydrates, protein, vitamins, and minerals you're going to need. Now, this can be done several ways. They can put the tubing through the nose into the stomach or the small intestine, or they can put it through the skin right into the stomach or the small intestine. And of course, this is started in the hospital because they have to determine how much nutrients your body can handle. Then they have to determine the rate that the nutrients are entering your system. Now, they want it to be that it doesn't impact how you lead a normal life. Okay, the next slide. Now, total parental feeding, or TPN. This is when a person cannot eat or absorb, actually it should be cannot eat and absorb enough nutrients to support the whole body. So this means the small intestine is not absorbing. And that's when they bypass the whole gut, give the gut a rest, and then they use the vein to get the nutrients into the body. Again, this is started in the hospital because, again, they have to calculate the nutrients you need, how much fat, carbohydrates, proteins, vitamins, the trace elements, all of that, how much of it you need and how much of it you can handle. And then they also have to figure out the right rate that the nutrients enter your system. Again, a good team is going to include you in the whole process. So based on your system, you can have total TPN and nothing by mouth, or you can have partial TPN, and then you can eat some of your calories. So as an example, myself, I'm on TPN, and I can eat a little bit. The other reason they want you to keep eating is so that the muscles in the esophagus, the muscles in the stomach don't atrophy. They have to keep being activated so that you can lead a normal life. Okay, next slide. So this is where I talk about real life experience on TPN. So again, I did this by trial and error. I couldn't find anything that could help me to eat while I was on TPN. And so kind of used my background training to come up with something that is doable for me. So again, it's small meals throughout the day. And again, it's not grazing. I eat a small meal, then I rest. Eat a small meal, then I rest. And then we can eat fruits and veggies. Now, because I also have SIBO, I can't eat ripe fruit because the ripe fruit is just going to feed the bacteria in the small intestine, and I'm going to have a SIBO spiral. So to avoid that, I eat small amounts of fruit, but it's unripe fruit, so that, and I'm also going to eat enough so that I'm not feeling bloated afterwards. I can eat small portions of protein, so I do fish and lamb, and I found for me, it was better to avoid the simple carbohydrates and the complex carbohydrates. So the simple carbohydrates are like juices that really activates the SIBO because the bacteria are just going to flourish on that. And then the complex carbohydrates also, because they have some sugar in there, the bacteria is going to get to it before I do. And then I also pulled out the foods that trigger inflammation. So these are going to, I put as an example there, nightshades. That's just one group of foods that triggers inflammation. So I pulled those out. And so my diet is pretty much paleo and autoimmune diet. With that one, I can function the whole day and not have any problems. My energy level is at a good level and I don't get brain fog. So it helps me work through the day without a problem. So I work full-time at City of Hope. I teach part-time, and then I also do my practice as well. So I'm able to balance all of that with the calories that I'm eating and the calories that I'm given in the TPN. Okay, next slide. Okay, so summarizing, so pseudo obstruction, your team is going to determine your antibiotics and they're going to rotate through those because the idea is to get the SIBO down. And then you can also supplement it with elemental drinks. And not all elemental drinks are the same. Elemental drinks, I know everyone is going to think of, what is it? Boost or Ensure. No, not those ones. The one I suggest is called Subdue. Let me see whether I wrote it down here. No, Sub, S-U-B-D-U-E. That is a true supplement elemental drink. Back in the day, you had to get a physician's prescription to get that supplement. And then insurance used to pay for it. But I guess now they want to make money. And so you don't need a prescription and insurance, I don't know whether they pay for it anymore. But at least with the Subdue, which I told you, is truly elemental. They've put all the nutrients that you need in there, the vitamins, the minerals, the other compounds that are going to help the body, and they're broken down to their smallest molecules so that the absorption can start taking place in the mouth. Oh yeah, Subdue. S for Susan, U for umbrella, B, and then D for dog, U, E, Subdue. As I was saying, that's a true elemental drink. So absorption starts taking place in the mouth, in the esophagus, in the stomach. It doesn't have to wait until it gets into the small intestines. And then if your small intestines are not absorbing, it will absorb most of this because it's broken down into its smallest molecules. So that is easy to transfer into the lining of the small intestines and easy to carry around the body. And then again, through my experience, a paleo autoimmune diet will be most effective. And again, if you're going to need to go on TPN because you're not getting enough nutrients to supplement the whole body. In addition to that, walking or physical activity is going to manually move the gut muscles. So that's going to help as well. So after you eat your little meal, try and get some walking in, 15, 30 minutes, that's going to help. This is going to apply for the yoga principles as well. Same principle applies. There are some stomach muscles you can work on that are going to manually move the food. I will give an example. And this is a yoga lady that used to go to the Scleroderma national conferences. And she told us they used to call her the poop lady because she will do the stomach exercises with everybody in the class. An hour or two after that, people will have 2 or 3 bowel movements. So again, the yoga principles, you want to apply them to the stomach because they're going to manually move things to move around so you can have a bowel movement. Okay, and then with SIBO, we talked about can cause intolerances. So be aware of that. If something you're eating is causing you more gas, that could be an intolerance. So look through for that. And the solution for that in the literature is saying a Fodmap diet. But again, the Fodmap diet is not going to cure SIBO. It's just going to lessen the symptoms. And your neurogastroenterologist and rheumatologist are the ones who are going to figure out what is the underlying cause of your SIBO. And that needs to get treated before the SIBO will get better. And again, with SIBO, you can do trial and error. Or the other thing you can do is the intolerance test as well. And so I've done that, and it showed me which foods I was intolerant to. And I already knew some of the foods which I was intolerant to, and I pulled those out and helped me a great deal. Okay, next slide. Okay, so now scleroderma also affects the large intestine. The function of the large intestine is, again, help form stool and move waste along and get that excreted. So one of the main problems that we get is constipation. And here are some solutions. The first 1, 2, 3, 4. The first 4 is directly from the literature. And so they're saying drink 8 to 12 glasses of liquid. And again, this can include prune juice. Prune juice has been shown to help with bowel movements, and this has been for years. And then you can also drink some teas. So you want to eat some fruits and veggies and whole grains and beans, but take as much as your stomach can handle. If you're getting bloated with them, maybe it's too much for your stomach, and just wind back a little bit. And again, these are going to be healthy for the intestines because it sweeps the intestinal walls and keeps things moving. And you also want to move. So walking after you eat, and then doing the yoga stretches that work on the whole gut, that help with peristalsis. Then you also want to have regularity. So most people have their bowel movements in the morning. If you can pick a time and just make sure you keep to that time every day, that's going to help with regularity. Now, the last suggestion at the bottom, the first one, physical therapy, I found that in a recent article on scleroderma and helping movement in scleroderma. So that article was maybe 2 or 3 years ago. But I've also used it, and it has helped me. So physical therapy, they have a lot of people who have GI problems. So a lot of them is usually based on the medications they're given, where peristalsis is not working the way it should be. And so they're used to that. And so I just asked them, and they said, oh yeah, we do work with that. So they can also manually move things so things can move out. And of course, there are exercises that they're going to suggest, and that usually helps for me. The other one I put there is MFR, that is myofascial release. Myofascial release is used a lot in Europe and in Australia. What it is, it's a type of massage that works on connective tissue. We produce a lot of connective tissue. So for scleroderma patients, it works, it helps. I learned about it from another scleroderma patient at the national conference. And so I've been using myofascial release since 2007, and it's worked for me very well. That is also can be used to move things in the GI. So now that I have pseudo obstruction, MFR is helping me to move things through the GI. And when I've given this presentation a couple of years ago, and at the time, no one was using MFR on scleroderma patients. And this time, when I was preparing for the presentation, I just did a search, and there's more research on MFR and scleroderma patients. A lot of it done in Europe, and then some done on the East Coast. I even found a physical therapy student working on her dissertation, and she worked on a scleroderma patient, and she showed how MFR worked, increased range of motion on many of the participants' joints, and it also helped with Raynaud's. So there's now more research here in the US on the use of MFR on scleroderma patients. Okay, next slide. Okay, so this one, we can go through it a lot more faster. So these are suggestions for getting nutrients in while dealing with some of the common scleroderma problems. Okay, the next slide. So I've gone through this. You have no appetite whatsoever. You don't want to eat whatsoever. These are just some steps that can help you get some of the nutrients in. So it's best to plan a daily menu or have a meal plan ahead of time. And then have a friend or a family member help you prepare the meals ahead of time. And then again, fresh foods are more appealing than processed ones. And you want to eat 1/3 of your calories in the morning. And then again, eat small, frequent meals throughout the day, because these are going to give you energy. And eating should be an enjoyable experience with family and friends. So see whether you can eat with family and friends, or maybe eat in front of the television, but definitely make it an enjoyable experience, and then it won't be so hard. Okay, next slide. So here is an example of a meal plan for someone who is not feeling hungry whatsoever. So bowl of mixed sliced fruits, and then you can follow that with the vegetable omelette, and you share it with somebody, that will be great. And then for a morning snack, celery and peanut butter, or crackers and chips. There's dairy-free cream cheese, which is really nice. And put that with green onions and black pepper. And then for lunch, you can have a stir fry with mixed vegetables. Put a little piece of protein that you like, chicken or fish. Add some rice to that. And then for dessert, have a fruit smoothie. And then as a snack in the afternoon, a turkey wrap with tomatoes, avocados, some lemon juice on there. And then for dinner, the salmon with potatoes and spinach. Okay, next slide. Okay, so with scleroderma, we can get dry mouth because of scleroderma itself, or because of the medications we take, or it could be another autoimmune condition that is coming on. So we want to drink as close to 8 to 12 glasses of liquid, preferably water, throughout the day. So back in the day, like, 2 years ago, when we were walking around, going everywhere, take a bottle with you and sip on that throughout the day. And you want to eat soft, moist foods like fruit smoothies, soft cooked fish, grass-fed beef. Let me touch on that real quickly. Grass-fed beef gives you more omega-3 fatty acids. Remember, omega-3 fatty acids are antioxidants. We want antioxidants because they soothe the body and prevent it from getting overstressed. Corn-fed beef is high in omega-6 fatty acids. Omega-6 fatty acids open the pathway to pain. We don't want pain. That's why we want grass-fed beef. Omega-3 fatty acids block the pain pathway. Okay, then we want moistened foods. So we can make homemade broths, soups, and sauces. Bone broth is really, really good. So if you can make bone broth, and there's so many recipes online, that would be an excellent choice. And then suck on frozen fruit. I'll take out candy for now, but suck on frozen fruit. You can freeze grapes and then suck on that, ice chips, sour lemon, all of that is good. And then the other thing to avoid is mouthwash. Mouthwash, they put alcohol in there that dries the mouth. So if we can avoid it or find mouthwashes that don't have alcohol in it, that would help. Now, if you have a sore mouth, of course, you want to avoid tart acidic fruits like vinegar and citrus juices. For a sore mouth, lukewarm, creamy, soothing foods are going to be good. And if you've noticed, I've put mashed cauliflower. For those who can't take the nightshades and can't do the potatoes, we can do mashed cauliflower and gluten-free pastas. There is so many now, and I think you can even make it at home. And then season with hot herbs, basil, oregano, and thyme, and also eat soft, moist foods. Again, the fruit smoothies, soft cooked fish, and I've added in there the elemental nutritional drink, Subdue, because it's truly elemental compared to the others that are on the market. Okay, the next slide. So I've also gone through this where we feel nausea. So of course, with nausea, any food is just gonna make things worse. But again, if we can do small meals throughout the day, so just a little bit, then rest, just a little bit, then rest. We don't want grazing throughout the whole day. We want small specific meals and then rest. And then eat dry foods. So there's gluten-free crackers, there's gluten-free toast, there's gluten-free dry cereals. So dry foods can help. And then sip liquids throughout the day. And so this is going to help with dehydration. And then sit up for at least 3 hours after eating. And this would be a good time to do your 30-minute walk and then come back and just sit and wait. And then also bland foods are better tolerated. And also let's suck on hard candy like peppermint or lemon, or if not, freeze some grapes and you can suck on that. Now for diarrhea, they have some replacement electrolytes. Pedialyte, I used to take that until they started putting in corn. Okay, I'm intolerant to corn, so I made my own. The WHO has a recipe on how to make electrolyte replacement drinks. But I think you can find any type of recipe now online, and you can add on there flavors that you like. And then also eat and drink foods that are high in potassium. So this will be fruit juice. I would rather go with avocados and bananas. Avocados are really good. And then drink and eat foods that are also high in sodium. So these would be broths. This is where bone broth is really good. Flaky fish, and you can just do a small portion. And then you can do beans. Okay, I just saw an alternative applesauce. Pear sauce, you can make it now. You can make all the sauces you like, depending on which fruit you can take. Okay, and then you want foods that are high in pectin. That's a fiber that helps rejuvenate the gut lining. So apples, applesauce, bananas, applesauce. If you can do applesauce, find another fruit that you can pulse and make into a sauce and use that one. And again, eat small frequent meals and sip on liquids to prevent dehydration. Okay, next slide. Okay, we are done. So I'm open to questions.
Okay, so questions. I've got a couple that I shared that were sent to me via email.
Yes.
And I saved them on a screen. First one was, I don't have celiac disease. Still, should I avoid gluten?
And again, yeah, you can do the poor man's test. You don't have to have celiac. You can also be intolerant to gluten. So if you have an intolerance to gluten, you're going to react. And so you can also do the poor man's test, eat pasta, drink beer, have everything that has gluten in it. See how you feel the following day. If you don't have if you don't end up with pain, headache, GI issues, then you don't have a gluten intolerant either. So that will be good.
Thank you, Susan. Next question. I don't even know if I'm saying this right, xanthan gum or psyllium husk safe for the GI? We are making gluten-free homemade bread and looking into options.
I know. Okay. You want to get away from those because they will trigger a reaction in some scleroderma patients. It totally reacts with me. So when I used to make my banana gluten-free bread, I didn't put it in there. There are other options you can use.
Okay,
yeah.
Thank you. Next question. Is too much vitamin E bad for your vitamin E bad, or your body gets rid of the excess?
Yeah, the body's just going to get rid of the excess. It's a natural one found in foods. So I would rather you take the natural one than the supplement one found in the stores. Okay. So the natural one, if it's too much, it will just be excreted in the body. But you can never get too much antioxidants in a body that has an autoimmune disorder.
Well said. Thank you. Should we have a neurogastro in lieu of regular gastro or in addition to regular gastro?
No, you want neurogastroenterologists. They are the ones who are going to understand motility issues. They're the ones who are going to pick up on things that are going on in the GI. Forget the gastroenterologists, the general one. They don't understand the GI stomach. I can give you an example because I went 3 years ago, okay, maybe 5 years ago, I went to a general GI doc at the local hospital. And he tells me, oh yeah, I've worked with scleroderma patients, thinking he knows what he's doing. No, he did not know what he was doing. I ended up at UCLA, and I actually searched for a gastroenterologist, okay, the word. And she's the one, and I'm telling her what I'm going through, and she's finishing my sentences. So she knew exactly what I was going through and what I had.
Okay, thank you. I heard unrefined organic sustainably resourced red palm oil is good for you. What are your thoughts?
Wow, I haven't heard of that one. But if it's based on the words that are given in that sentence, if it's unrefined, I think that might be good on the body. But a good thing to do is to look it up, Google it on the internet, and see what articles come up on that compound. Then you can see whether it's good or bad.
Okay, thank you. And let's see. I guess during your presentation, when you were talking about some of the fruits, one of the questions was, isn't citrus food bad? Wouldn't that include tomatoes? But I think you kind of broke that down, but can you maybe give a quick overview on that?
Yeah. So there's a difference between citrus foods and nightshades. So tomato, yes, it's citrus, but it's in the nightshade family. So not all fruits that are citrus are in the nightshade. So depending on what fruit you're talking about, fruit or vegetable that you're talking about, Google it and see whether it's the nightshade family or not, or whether it's not allowed for those on an autoimmune diet. But citrus doesn't mean that it's bad. Actually, like strawberries, berries, and other citrus fruits are really good for someone with an autoimmune condition because they're high in vitamins, they're high in like vitamin C, they're high in antioxidants. So that's good for us, and we want to take those.
Thank you. This kind of goes along with it too. I had microbiome testing through Viome, nightshades not recommended, such as tomatoes, bell peppers, eggplant, etc., since they cause inflammation.
Yeah, that is true.
Okay. Dark chocolate, question mark?
Yes, that's good. We can do.
I wish it was milk chocolate. I like that better. Okay. Salmon has mercury. Is it recommended to eat some salmon, but get extra omega-3 from fish oil?
No. I should say it politely. No. The idea is to get it from wild caught salmon. Not all wild caught salmon is going to be high in mercury. It depends where the salmon is caught. You can get organic, good salmon from Whole Foods. So not all wild caught salmon is high in mercury. Now, getting all of these omega-3 fatty acids and all of the compounds I talk about, it's best to get them from the natural source instead of tablet source.
Thank you. Do eggs increase cholesterol? It is a common belief.
Well, actually, it's not well, let me rephrase it. In some people, it raises cholesterol. In others, it doesn't raise cholesterol. So it's going to depend on each individual. So it's best. Okay, I don't know whether that doctor is going to really help, but I guess they can, take some eggs, not every day, but every couple of days, and then check whether their cholesterol has gone up or not.
Yeah, little mini study.
Yeah.
I'm not really sure where this comes from. It could have been why you were talking about grains. And it just says any grains with a question mark, but I don't know where in your presentation that came up.
Oh, I think they were asking whether they can eat any grains.
Okay.
For now, I'm going to say yes, and we want to eat it in proportion.
Thank you. Seems whatever I eat gives me gas, burping, and bloating, especially veggies. What's your comment on that?
So it could be that you're eating more veggies than your body can handle. And so that's one way to see or to know that you're eating too much veggies. I know we want to try and hit the guidelines that are given by the Surgeon General, but since we have motility issues and GI issues, only eat as much as your body can take. If you're eating too much veggies, maybe just bring that down a little bit, and just eat enough, but you don't want to get bloated.
Okay.
I hope that's making sense.
I'm going to try to get through these quick because we're actually already a little over time. One, I guess you were talking about strawberries and blueberries, and it says, what can you eat if not strawberry or blueberries?
Are there any other berries that they can eat, like blackberries? Because the berries are the ones who are high in antioxidants that are good for us, especially with autoimmune conditions.
Thank you. Let me see here. Can a regular GI specialist order a SIBO test, or does it have to be a neuro GI specialist?
Okay, you can, if this regular GI understands the motility issues and the scleroderma gut. Actually, I had my SIBO test, the methane gas test, but it was with the GI guy who's the guru in celiac, because he's the one who told me, oh yeah, scleroderma people always have GI issues, and they're gonna have gluten intolerance, and a percentage of you guys are gonna have celiac. So to him, it was normal. And the thing was, he was Italian. So he worked at Boston General, and then in the summer, he would go to Italy, and he would see scleroderma patients as well. So he understood that.
Good. And just from experience, a lot of GI physicians are learning, and they will order it, but I don't know how many versus the neuro ones that you're talking about.
Yeah.
Okay. And some rheumatologists too.
Yeah.
It's a question, does lamb have more benefits than grass-fed beef?
Hold on, what was the question again?
Does lamb have more benefits than grass-fed beef?
Well, okay. So also the lamb needs to be grass-fed, because not all of them are grass-fed. Some of them are finished on corn. So you want 100% grass-fed. Now, the lamb might be a little more leaner, but the beef, the grass-fed beef, is gonna have more beneficial compounds in it because it's been living longer. But we also have to understand that the grass-fed beef might also have negatives, because a lot of red meat has been linked to heart disease and diabetes. So we need to eat that in moderation.
Thank you. Do you think organic monk fruit sweetener, or is it stevia, is okay for baking, or do you recommend any other type of specific sweetener to substitute for sugar?
Okay, so at City of Hope, we have a Garden of Hope, and we actually grow stevia. You can grow it as a crop. Now, if you're using that as a sweetener, then yes. But the powdered man-made one, no. And then the other sugar, I haven't heard of it before. But again, if it's all natural, that would be the better option.
Thank you. I'm not sure where this came up in your presentation either, but they were asking what type of beans. Does that ring a bell for you, Susan?
Oh, I think because I said people can eat beans, I think any type of beans now would be okay. But another thing they can do, they can look up the health benefits of those specific beans and see whether it was really beneficial for them as well.
Thank you. Can you recommend a name of the type of specialist? Is it I think you already said that. Penny, right? I think she already talked about the neuro GI. Is that what you were talking about? In your question, can you recommend a name of that? Oh, a name of the doctor, you mean?
Yeah, I mean, I've never heard of, you said is it a neurogastroenterologist?
Yes.
I've never heard of that. Do you know of what hospital has somebody like that?
Yes. UCLA.
Of course.
Dr. Terry Getzug.
Okay.
Yeah.
And maybe, I guess, just looking for that specific wording when you're looking up maybe their bios and a little of their background.
Okay.
Okay. Do you have a favorite omega oil? Walnut, avocado oil, or MCT oil?
Avocado oil, yes. What was the other one?
It says omega, walnut, avocado oil, olive, or MCT.
Actually, all of them are pretty good because they're nut-based. And so that's going to be good for the body.
Okay. You mentioned fresh fish under smash. Is there a problem with ocean caught smash fish?
Yeah, ocean caught, yes, but not sustainable one. The sustainable one, they give them antibiotics because they grow them in big ponds and they're overcrowded. They feed them corn pellets and they have to add in additives to make the flesh more pink. So keep away from sustainable fish. You only want wild caught.
Thank you, Susan.